What exactly is C Diff? Well, C Diff basically stands for Clostridium Difficile bacteria. And that bacteria is acid resistant, which means it can get inside your intestines, and it's resistant to the acid inside your stomach. It is also resistant to antibiotics such as ciprofloxacin and levofloxacin. On top of that, it's resistant to heat as well. And the bad news is alcohol-based hand cleansers don't actually do anything to stop the bacteria growth. So you've got resistant to heat, resistant to alcohol-based hand cleaners, resistant to antibiotics, which makes it perfectly suitable for an environment such as a hospital or a nursing home. And it's also acid resistant as well, as we mentioned earlier. Now, how exactly is this transmitted? Well, the book definition would be the fecal oral route. Basically, you have asymptomatic carriers. For example, we could have patients that have it but are resistant to it, or we could have healthcare workers that don't wash their hands or don't wear gloves. And we could have also infected patients, and they transmit the airborne spores. And the signs and symptoms of C. diff are, well, we have this Clostridium difficile bacteria, as we mentioned earlier. It produces a bunch of toxins. The most common toxins are toxin A and toxin B. And those toxins produce problems such as diarrhea, inflammation, abdominal pain, and fever. The two most common are diarrhea and inflammation. How exactly do we go about diagnosing this, or what's the diagnosis? Well, there's this thing called cytotoxicity assay. And what that basically is you culture some stuff and see if you can find the bacteria. Now, it takes a little bit of time to do that. We can also do testing for toxins, the toxins A and B, which I mentioned earlier. There's a stool diagnostic test. We can also try a CT scan and a PCR test. Now, what forms of treatment are used? Well, as we mentioned earlier, it's resistant to certain types of antibiotics, or certain strains are resistant to certain types of antibiotics, but there's other antibiotics that are effective. Those antibiotics include metronidazole, that's one. Vancomycin is another. And a third one that's found to be effective is fidaxomicin. Now, also, when you look at prevention, washing or cleaning stuff with a hydrogen peroxide vapor, or HPV, has been found to be effective for cleaning like different types of surfaces and stuff. Another option for prevention would be bleach, like bleach containing sodium hypochlorite. And another option to try to treat it would be a stool transplant, more specifically like an injection of bacterial flora. And what they're trying to do is reverse the imbalance in the intestines, because there's a bacteria imbalance, try to reverse that. And that essentially wraps up our overview of C. diff. Thank you for watching.